This year, as we celebrate International Day of the Midwife, we acknowledge the unique contributions midwives have towards the health and well-being of mothers and their newborns. This has been a challenging year, and I would like to thank our Directors of Midwifery and all midwives for their continued contribution to high standards of care, but also their innovation in line with the challenges. Let's hear it for the midwives, and let's hear it for the innovations in midwifery practice.
Even though a lot of our practice has changed because of COVID-19, one thing that hasn't changed is that women are still the very centre of our care. So anything that we can do to adapt to meet the needs of women and their babies, we will do our very best to do. One change that I have made that I feel meets their needs is virtual workshops for the women to prepare for breastfeeding. I offer the women a weekly workshop in preparation for breastfeeding so that they know what to expect when their babies are born and they have realistic expectations of feeding their baby after birth. I also send them information online now, and they have more access to information of videos and information links so that they can access the information from home. I do think that going forward this might be a change that we will continue.
We have changed and innovated in the way we deliver our care. We have reconfigured our ward rounds and our antenatal recall clinics. This has resulted in a more women-centred approach. There's a consultant based in the clinics every single day. There's one consultant on call on the ward. This change has resulted in improved patient flow, improved patient care, better teamwork and communication, and better clinical decision making.
The changes we have implemented due to COVID-19 is we are now telephone booking our patients. This is a patient-centred an initiative. Patients are in their own home, they know what time we're going to phone, and less exposure to the risk of COVID-19. This small change in practice has actually resulted in a reduction in one of the visits that they have to make to the antenatal clinic.
COVID has brought many changes to the women of gestational diabetes. One of the changes that has occurred is how we deliver education. We're currently doing this online at the moment. We're also offering virtual clinics where they can upload their blood sugars, which is actually proven to be very beneficial for the women. It's cutting down on the time in clinics. This is actually giving them a little bit more support, that we're able to access the emails throughout the week and maybe intervene where possible if there can be small changes made, which will actually in turn help their care and improve their outcomes. The feedback we've received from the women is they're happy that the clinic waiting times has been cut down, and they feel supported during their pregnancy in what can be a difficult time.
Tuesday the 5th of May 2020 is International Day of the Midwife. I'm delighted to be celebrating this day for our profession and continue to provide care in light of COVID-19 to all women attending our services.